Assalamualaikum and good morning everyone. My name is Nurin Taqiah bin Dahman. My Matric number is A120127 and I am from LMCE 209270. Today, I would like to present my speech entitled The Malaysian Government Should Implement Stronger Disease Surveillance in Schools. Imagine sending your child to school every day completely unaware that the classmate sitting beside them is carrying an infectious disease and no system exists to detect it before it spread. Without proper monitoring, that illness could quickly spread to dozens of students before anyone even realizes what is happening. This situation may sound worrying, but it reflects a real risk that can occur when disease monitoring in schools is not strong enough. This issue affects everyone here because schools are environments where students interact closely every day. Children spend most of their time in classroom, which makes them highly vulnerable to disease transmission. If disease monitoring in schools remains weak, outbreaks can disrupt education, the danger students' health, and affect families across the country. So, I would like to ask you, how safe do you feel sending your child to school every day? To better understand this issue, I have researched and report from credible health organizations that highlight gaps in schools' health surveillance systems. This study shows that schools without proper disease monitoring often experience delayed outbreaks and detection. For example, according to Donaldson and others in 2021, weak disease surveillance significantly increases health risks among students. This clearly shows that the current system is not sufficient to fully protect students in school's environment. Therefore, strengthening disease monitoring system in school is essential for safeguarding student health. In my speech, I will first discuss the problem caused by weak disease monitoring in schools, then propose practical solutions, and finally explain the benefit of implementing stronger disease surveillance systems. To understand why action is necessary, let us first examine the current problems in schools' health monitoring. Many Malaysian schools lack effective disease monitoring systems, which increases the risk of outbreaks among students. Schools are major settings for disease transmission, and without proper monitoring, infection can spread quickly among children, as highlighted by Donaldson and his team in 2021. In addition, many schools still rely on traditional paper-based absentee reporting. According to Ashton in 2015, this system limits timely outbreak detection, especially in rural schools where resources may be limited. Weak surveillance reduce the timelines of outbreak alerts, delaying intervention and putting students at higher risk, as emphasized again by Donaldson and others. When outbreaks are detected late, the impact is often more severe, affecting not only students but also the teachers, parents, and the wider community. Since we know the problems, let us now consider potential solutions. The government can strengthen disease monitoring in schools through structured systems, digital reporting, and integration with health authorities. Research by LPN College in 2017 shows that electronic absenteeism system allow faster detection of abnormal illness pattern, providing early warning of potential outbreaks. Furthermore, school absenteeism data can be used for surveillance tracking system to detect outbreaks earlier than traditional methods, as explained by Donaldson and his team. Another important solution is linking school monitoring system with local health center. According to Ashton, this approach enables timely investigations and response to emerging infectious diseases. These solutions are practical, achievable, and have already been implemented successfully in other countries. With the solution in place, the benefit of strengthening disease monitoring become clear. Implementing disease monitoring system in schools protects students and the community while supporting public health. According to the World Health Organization in 2020, yearly detection of outbreak reduced infection rates and prevent widespread transmission in schools. Effective monitoring also allows schools to respond quickly, minimizing disruption to education and learning schedule, as highlighted by Nurin and Lee in 2022. In addition, research by Tsang and his team in 2023 shows that school absenteeism surveillance correlates with community disease trends, providing valuable data for public health planning. This means schools can act earlier warning system for the entire community. Clearly, the current gaps in school disease monitoring system cannot be ignored. Weak monitoring system create high risk of disease spread. Digital solution can strengthen detection, and effective monitoring provide significant benefits for students and community. So, I urge all of you to support government initiative to improve disease monitoring in schools and to raise awareness about its importance for student safety. As public health experts often say, prevention is better than cure. This reminds us that strengthening disease monitoring system in schools is not just about responding to illness, but also about protecting the health of our future generation before outbreak even begin. Protecting our students today ensures a healthier and safer tomorrow for our entire nation. Remember, a single child illness can affect dozens. Let us act now to prevent it. Thank you.